Raise your hand if you know anyone that has ever contracted measles. Now, raise your hand if you know anyone who's contracted pertussis.
That's a big word.
That's probably because they received a vaccination to help them not get the disease. However, this is currently changing. Many people are deciding not to vaccinate themselves. Due to medical research and anti-vaccination, there is an immunization and vaccine crisis that is developed that is a threat to global health. The College of Physicians of Philadelphia, a nonprofit institution promoting the future of medicine, explains that Andrew Wakefield linked the development of autism to the MMR, or the measles, mumps, and rubella vaccine. Andrew Wakefield, a gastroenterologist, published this information in 1995. New findings show that Wakefield conducted false research, which caused his medical license to be revoked. There are currently no published studies that find a link between autism and any vaccine. Due to Andrew Wakefield's research, many individuals have chosen not to vaccinate themselves or their children. These individuals who are not vaccinating themselves are known as anti-vaxxers for short. In defense of anti-vaxxers, the College of Physicians of Philadelphia explains that chemicals in vaccines can be very dangerous to some people. And it is also still a theory that they are linked to developmental disorders such as autism. Many individuals that don't vaccinate themselves have not witnessed a case of a vaccine-preventable disease, which causes no sense of threat or fear to them. So, however, when an individual chooses not to receive a vaccine for these reasons, the diseases they prevent begin to spread. The Centers for Disease Control and Prevention, also known as the CDC, the governmental agency for health protection, reported numerous outbreaks and cases of measles and pertussis. In 2019, there have been 1,044 individual cases of pertussis in the United States so far. And you can see on this map, all the dark blue states are those that have had outbreaks in cases of measles, which you can see that here we are in Ohio, and we're surrounded by many dark blue states, including Pennsylvania, Indiana, Kentucky, and Michigan. So even though we haven't experienced any in Ohio, they're still surrounding us. And in addition to the measles, the annual number of pertussis cases are gradually increasing. And you can see on this graph here that in 2012, about right here, was the year with the largest number of pertussis cases. And as we're going towards 2017, 2018, it's on a gradual incline versus if you look about here on the graph. Clearly, the active anti-vaccination is causing an increase in the spread of disease. So, these vaccine-preventable diseases are responsible for the death of many, as with many diseases. The Children's Hospital of Philadelphia, the nation's first hospital devoted to pediatric research, explains that measles is now one of the top causes of death in children. This is not only occurring in the United States, but in many underdeveloped countries throughout the world as well. Before you know it, these vaccine-preventable diseases, such as measles and pertussis, like you saw, could be knocking on your front door as they continue to spread as a result of anti-vaccination. As I've presented, due to medical research and anti-vaccination, a vaccine and immunization crisis has developed that is a threat to global health. As an individual, you have the choice of whether or not to vaccinate yourself, and just as important, we're all future parents and grandparents with the responsibility of keeping our young ones healthy. It's never too late to make the decision to vaccinate yourself, your children, or your future grandchildren. Vaccines are the difference between life and death.